Hi, and thank you for joining me for another episode of Therapy Get You Some. This week I'm doing much better. If you listened to the episode last week, I was struggling. And one of the things I talked about is how my faith helped me to overcome. And I mentioned missing my family. Just being home with my family has helped me to recover so much. So if you're watching, you can see I look like I'm doing better. I'm doing much better. One of the things I was struggling with was imposter syndrome. And so I thought that's what we talk about today. What is imposter syndrome? First, as a clinical social worker, I have to point out that imposter syndrome is not a mental health disorder. So when someone says I have imposter syndrome, that's not an actual diagnosis. It really is more of a phenomenon, meaning that it's something that we as people have noticed happens in a certain situations, but it's not a mental health condition. It's not something that you can get a diagnosis and medication and treatment for. It really is where you have to do that internal work. So a little history about imposter syndrome. Imposter syndrome was first recognized by two female psychologists in the 1970s who noticed in themselves first and then went on to research it and do a study that they also noticed in others that at times, as women especially, we show up in spaces that we are not necessarily welcomed or people are not used to seeing us in. And then we start to question whether or not we belong. So imposter syndrome comes from that sense of feeling like I don't belong, or not necessarily that I don't belong, but wondering if I do belong because when I look around the room, I don't see myself in the others who have been invited. So it's this questioning of your abilities, questioning of your accomplishments, questioning of do I belong in this space? And what happens over time with that constant questioning is it creates stress. And in those stresses, you start to either try to outperform others to validate your belonging, or you start to become very afraid, anxious, and things like that. And so that is what I was struggling with last time we talked. And once I named it, I was able to really overcome it. So it's so important that when you recognize what you're going through, that we have the language to call it what it is, right? And so that way I can, once I know, okay, this is imposter syndrome, that's what I'm battling, well, then I can use the tools that I have to battle imposter syndrome. So, as I was saying, for me personally, when imposter syndrome shows up, it's that superwoman. I can do it all. Just throw it at me. I can handle it. And truth be told, yes, I can, but at what sacrifice? At what cost? And so the cost sometimes is my diet, or my physical activity. So I have more work than time. What I will do is give up any me time. And so then when your self-care goes, then you're going to start to do what I was doing, which was struggling. But that was how I battle imposter syndrome. I definitely go into the superwoman. I can do it all. And not only can I do it all, but I can do it all and be the best, which is it's a level of stress that can only last so long before you crumble under that pressure. So imposter syndrome, the categories are the things that you'll notice in yourself or in others when they're battling imposter syndrome is the I can do it all, right? Even if some things are asked of you that are not your job, that are outside of your scope or not in your wheelhouse, you won't speak up or say anything because you are fearful that other people will recognize you don't belong. And so to feel like you belong or to give yourself a level of value, what you do is you take on all roles. The need to be the best. Like, not only can I do it all, but I'm going to be excellent at it. And I recently heard someone say that there's a difference between being perfect and being good enough. And when we are trying to be perfect, that's where the stress comes in. And that's one of the things I battle with is I want to be not just good, I want to be the best. So I'm not only going to do it, but I'm going to be at the top of my game. You have this internal fear of failure. Like, what happens if one of these balls I have in the air drops? And so that's an extra stress of I got to keep all this going constantly. I got to stay on. And there's, I'm on at home, I'm on at work, I'm on in my educational endeavors. How long can I be on without taking any time off? Any praise is rejected. And when you're battling super woman syndrome or you're battling imposter syndrome, somebody will give you a compliment, that's rejected. The slightest criticism or critique is held on to. And you use that as fuel to say, you know what, next time they won't catch me slipping. But you're not really slipping because you're trying to do too much. Then there's the fear of success. Okay, not only am I afraid to fail, but then what does success mean for me? What does that look like? How will I show up and be excellent forever? So then you have that fear for, like, if I get to the top and the pinnacle of my career, then what does that look like? So imposter syndrome can happen to anyone. Let's be clear about that. Anyone who lives in this society, we know that we have the value of overworking yourself to do more than what maybe is expected. That's part of the American value system. So this can happen to anyone. But let's be real. It's more likely to happen to us as Black women. And there's some reasons for that. Racism, you got to call a thing a thing. So racism tells us things that we know are not true, but yet we internalize these things that are not true. So I know in my life, tons, and when I say tons of Black educated women. Like, that's all that I surround myself with. But then for myself, imposter syndrome will say, well, who are you to get a doctorate? But I will big up all my friends who have them. So it's like one of those things that I have the mentors. I have people who have blazed the trail for me, but still I have that imposter syndrome that says Black women aren't educated. But where did I get that information from? So, that's the kind of stuff that happens, that you internalize that I don't belong, except I know people who are here at this level. So why do I feel like I don't belong? Because of racism. And also sexism. So, we don't think of women. When you think of, if I said doctor, describe a doctor, more than likely you're going to describe a white male. That's just because that's what has been ingrained in us as people in America. But that's not necessarily true. So we know, like I said, if I ask you to name a Black female doctor, we all know some. But when we think of doctor in general, we don't think of ourselves. So that's what fuels imposter syndrome. So lack of role models, even if you recognize you have role models, when thinking of them, you don't necessarily think of them that way, because imposter syndrome will have you downgrading their accomplishments. Like, oh yeah, she did it, but she had help or she had this, versus recognizing, one, it's awesome. For everyone else who has done this journey already, I admire you. I aspire to be in your on your level. But as people, we tend to downgrade when our own makes the same accomplishments, or we tend to minimize it or exclude it as it's something that is not normal. And so then we still don't have the role models that we're seeking. Prejudices that we have internalized. So, there are things that it is, society has told us this is true. We know it's not true, but we still internalize it and we believe it to be true. The motto, and all of us who have grown up in a certain era have heard, you have to work twice as hard and be twice as good to get half as much. That has been internalized. So then when you walk into a space, you come in, as I say, you come in on ready. You come in on, I already know I'm going to be rejected, so let me show you how I have value by working twice as hard. Again, those things are not helpful, but that's been taught to us, and those things have been internalized by us. The toxic workplace environment. So the reality is, not only have we all internalized this, but we've all had lived experiences that show us that these things can happen. That I've had people say, how did you get XYZ as far as a accomplishment or accolade? Well, that's going to feed the imposter syndrome, because then I start to think, well, how did I get that? Versus feeling like, well, I deserved it. I worked really hard. I'm strategic in my career planning. That would never be my response. My response would be, well, I don't know. How did I get, and then it causes me to kind of spiral internally to say, well, maybe I don't deserve this thing, this job, whatever it is that I got, because someone else questions it. And then just society in general for women. So, it's like you have that, as we call it, double whammy. I'm Black and I'm a woman. So once you overcome like the racism aspect of it, which can you ever really overcome it? I don't know. But once you overcome that part and you recognize, okay, that's racism. I know what it is. Once I label it, I know how to deal with it. Then I still have to overcome the internalized aspects of being female, in this society, and what I think about that, and how I move through life as a woman. And so those things all fuel imposter syndrome. When you're battling imposter syndrome, the first thing is you have to recognize it. Because if you don't recognize this is exactly what I'm battling, you will internalize it as an individual struggle that then how do you cope? Then you start to feed it, actually, which is the opposite of what you're supposed to do. So the first thing you're supposed to do when you recognize what you're dealing with is imposter syndrome is call a thing and recognize this is imposter syndrome. That's what I'm dealing with. What are my coping skills for imposter syndrome? The first one probably will feel uncomfortable to a lot of people. I'm pretty good at it, and anybody who knows me knows this, bragging on yourself. So oftentimes, unsolicited bragging is looked at as being cocky, it's looked at as being unwarranted, and sometimes even, people will not like it. But for imposter syndrome, it's important. Not that you unsolicitedly walk up to other people and brag, because those people aren't asking you. It's you battling you. So for imposter syndrome, you have to go over your own resume. You have to read your own reviews. You have to remember who you are. You have to call yourself as great as you are. You have to remind yourself why you are getting the things that you are getting. Because I work hard. I strategically planned my career. I looked for opportunities to build myself up in the momentum for the trajectory that my career is taking. This is not by accident that I am where I am. You have to tell that to yourself. So bragging on yourself to yourself. And if the situation calls for, bragging on yourself to others. One thing that I often struggle with is before I'm presenting at any type of conference or any situation, they like to read your resume. And it always makes me so uncomfortable because it feels like I'm doing too much trying to, like they say, limit it to 50 words, which is really hard when you've done a lot. But it always makes me uncomfortable to hear my resume read while I'm in the room. Sometimes, especially when we're in the age of technology, I'll say, can you read it before I log in? But that is something that I am overcoming because, as I said, I'm battling imposter syndrome. So I want you all to read your own resume, read your own bio. Remember who you are, because that's how you're going to battle imposter syndrome. Positive self-talk, talking to yourself in a kind way. While I was in this 2-week intensive part of my doctorate program, I often wrote notes to myself. Honestly, these notes were not kind. And my peers would say, well, why do you do that? I was like, to remind myself, of everything that I need to do to get what I'm trying to get. But I could have been kinder to myself. I didn't have to say, you are confused. You don't know what you're talking about. Versus saying, clarify this part of the discussion so that it provides more information. I could have done it in a positive way, but at the point that I was in the throes of the battle, I wasn't in a positive place. So, but I'm giving you the hints to how to overcome it. And I'm reminding myself as I hear it. Positive self-talk, being kind to yourself. Learning just to say thank you. When somebody says you did an awesome job, my typical response would be, oh, it wasn't that, I didn't do that much. Knowing I worked hard on it. But and it's that battle to be humble versus just saying, thank you. Nobody, thank you. I worked really hard on that. That is something that feels difficult because it goes against the way I was socialized. I was socialized to be humble, to say, to downgrade versus to say, I'm doing well. Somebody says, how you doing today? Oh, trying to make it. Versus, I'm really doing great. I have a fabulous family. I have a wonderful job. I have friends who love me. No, I would never say that. I would say, I'm trying to make it. But learning to just say thank you or just say the truth. Accept imperfection as part of being human. I accept human in everyone else but myself. And I think that's part of what, again, from imposter syndrome, that I have to be superhuman. I have to be better than everybody else. So I don't need sleep. I don't need to eat because I have to get this perfect, which I'm a human. And so good enough might have to be good enough. Celebrating others. So like I mentioned, I have a tribe of women that love me and support me. I love and support them. I support, I will give them all their accolades at all times. And remembering that they have blazed the trail for me. So I'm not going to be standing up here on this mountaintop by myself. They're already up there. I'm waiting, I'm trying to join them. In celebrating others, it reminds you that they can do it. They're human. I can do it too. I'm human. And they will also support me. So, I have a really good friend, and I would call her and she would say, well, what's your theory? What's your research? And I would, thank you for helping me. But, like just that talking you through, knowing that you have somebody who has done this already, and they will guide you through this journey. So you're not by yourself. So seeking support, that's super important. And remembering you have people who support you in the workplace. So I'm talking about it from a personal standpoint as I'm on this journey for my doctorate. But sometimes imposter syndrome, or most often, it shows up in the workplace. Finding support in your workplace. And if there is no support in your workplace, finding support outside of your workplace. Everybody should have a tribe. Everybody should have a group of people who support them, who understand, who will praise them, who will do things that they are trying to do and open the door for them. So, like it just support. Also being assertive. Don't be afraid to say exactly what you need in the workplace, in the academic environment, and social environments. There are times when we may feel like we're the only one. Speak up. Say what you need. Call a thing, especially when in the face of racism. Don't be afraid to speak up and say something. Oftentimes, imposter syndrome will tell us, hold our tongue, because you're lucky to be in this room, which is so untrue. Remember, the room is lucky to have you. You were invited for a reason, and if you cannot remember what the reason is, go back, read your resume. They're lucky that you're in the room. They're lucky you accepted the invitation. So be assertive and speak up. And then embrace your differences. Oftentimes, especially as a Black woman, we're invited into rooms where we are the only one, or one of very, very few. We're invited for that reason. Like, that is part of it, because we're invited for that different perspective. So don't think that when you show up and you're the only one, that's a hindrance. That is part of your resume. That's part of why you're there. So remember that and celebrate your differences. These are the things that I'm going to do going forward. One of the things I didn't put on the list, but I talked about last time, which is, for me personally, the most important thing, is also your faith. Using your faith to help guide you through this journey and to overcome imposter syndrome. For me, that helps the most. And then your family. Surrounding yourself with love. People who just look at you and you don't have to do anything or be anything, and they love you. That also helps a lot as you're on this journey. Imposter syndrome, is not something that you just like, oh, I battled that, I'm over it, done, on to the next battle. It continues to show up. So as I'm saying, oh, I'm looking better, I'm feeling better, this is a long journey. I know it's going to show up again. The key is to recognize it sooner and to get in the battle with your tools, right? So the other key is, and I recognize this after the fact, is to never let self-care slip. Because once self-care slips, then these type of things have an opening. They have a space to come in and fester. So had I been continuing my self-care of, my proper nutrition, my proper sleep, my proper exercise, it would have been less likely that I would have struggled as much with imposter syndrome, because those things would have kept me more balanced. But once your balance is off, then the little slight do you belong can grow. So you want to keep your self-care. And again, that's a whole podcast in itself, talking about self-care. But I always want to talk about encouraging self-care any chance I get, because that is one of the best tools that we have. Okay. So imposter syndrome, name it when you see it. And the battle, continues for me and for all of you. I want to thank you for spending time with me today. And I will talk to you guys next week.